Hi everyone, I'm Dr. Miriam Smith. Welcome to the Empowering You Nurses show. I'm excited that you are here today. I appreciate your presence. In today's episode, we'll be talking about the stethoscope, the anatomy of the stethoscope. And you might ask me why. The reason behind that is that we have our nurses who use the stethoscope for assessment, in their assessment of the patient, to gain information that the plan of care can be made. And so we go straight at this time into the anatomy of the stethoscope. Now, the anatomy of the stethoscope. Here, these are the earpieces. Here, this metallic part here is known as the ear tube. The entire section here is very flexible. All this ear is considered the headset. Now, this is the tubing. The tubing is connected to the chest piece or the head of the stethoscope by this little metallic area, the stem. Now, the chest piece is made up of two components. Circular area here, the larger of the two, is the diaphragm. The diaphragm picks up high frequency sounds. The bell picks up low frequency sound. And so it's important to know the parts. And when you're doing your assessment, to use the appropriate area to make your assessment, to get your findings, to make your care plan. All right? Your findings will determine actions to be taken for this particular patient. So it's very important to know the structure or the parts or the anatomy of the stethoscope as you work. Now, if this has been of any help to you, I want you to subscribe. You can follow me on Instagram, Facebook, YouTube, and Podcast Mirror for further information. And if you do have topics that you would like to discuss, you may do so. You can also make a comment. If you would like a topic for us to discuss, we can do so. So let me know. It's great to have you here. And let me just remind you that this month, March, is Women's Month. And you are great, you are phenomenal, you are amazing, and we thank you for the work that you do. You can follow me again, as I said, and I look forward for you coming back as we continue to empower our new nurses. As our nurses gain more experiences, they'll be able to advocate for the patient, they'll be able to render high quality nursing care. Thank you. I'm Dr. Miriam Smith. For further information, and if you do have topics that you'd like to discuss, you may do so. It's a pleasure working with you, sharing and imparting the knowledge.